All right, so I'm going to give a update on our reopening plan. I caution everyone that this is still a work in progress. We are working with 5 subcommittees right now, and I'll talk about that in a minute. So this is not final. It will not be final until it goes to the county and is approved by the county. But there's a lot of people working on this. Many hours have gone into it. So I just want to caution everyone on that as we continue to go through. So a plan that supports the needs of our community, that's what we're looking for. 2 important pieces out of the restart plan for the Department of Education are the district's reopening plans must account for resuming in-person instruction in some capacity, and plans will look different at each district to meet the unique needs of our community. So we took all of that into consideration as we were working. The goals of our reopening plan include supporting the mental and physical health of our staff and students, using established and enhanced cleaning and screening protocol in our facilities, following all social distancing and PPE, that's personal protective equipment, guidelines in all facilities and buses, ensuring meaningful instruction is taking place in person and remotely for maximum academic progress, and ensuring all students have a working device and internet connectivity. Again, this plan is subject to change based on updated guidance from the DOE and the governor's office. All plans are preliminary, still need approval from the county superintendent's office, and many areas are still in the planning stages, so we are still working on this. We have 5 subcommittees, so I want to thank, I know there's a lot of staff members on our meeting this evening, many of whom are on the committee and many are just here to hear what the plan is. They've been working for several weeks to address these areas. We have 5 subcommittees: governance, health and safety, athletics, transportation, and teaching and learning. Mrs. Kalyapanowicz, Mr. Pelori, and Mr. Nikitinsky are part of the committees. So one of the first things we need to look at is our facilities and making sure that we're creating clean and safe schools. So we are in the process of creating protocols that will exceed the CDC and the Department of Health guidelines, which include classrooms, restrooms, buses, high-touch surface areas cleaned throughout the day using electrostatic cleaners and eco-friendly cleaners whenever possible. But obviously, we're looking at ones that will kill the virus. Schools and offices will have hand sanitizers in every classroom and office. Disinfecting wipes will be available. PPE, again, that's personal protective equipment for staff. So that's like masks, gloves, that type of thing that are needed. Plexiglass panels or other accommodations in high traffic areas, and signage. Our HVAC systems will run at maximum fresh air capacity, and we are also exploring working with a mechanical engineer to identify some of our HVAC needs. Outdoor spaces can be used for class meetings as much as possible, and the district is also working with Dr. Lynch, who's a council certified indoor environmental consultant, for guidance on cleaning procedures and protocols. So we ask that everyone does their part by following some guidelines. Do not come to work or school if you are exhibiting COVID-19 symptoms. Maintaining personal hygiene by washing hands frequently and completing the daily self-health checklist, and we'll talk about that screening a little later. Maintaining 6 feet of social distance in classrooms, workspaces, and common areas. Wearing face coverings at all times indoors, except in private rooms and offices, and outdoors when physical distancing is not possible. So we ask you practice now. This is for staff and students. Practice now by wearing a face covering and try to work up to a day of school. Covering your cough or sneezing into a tissue or your sleeve or elbow, and refrain from touching your face, shaking hands, or coming into bodily contact with others, and not sharing personal items. As was mentioned a little earlier, we are looking at policies and protocols for revisions. We are developing procedures for someone who becomes sick in school. Our nurses are working in consult with our district physician and the county health office to do this. Schools are preparing for isolation rooms in each school. So if a student or a staff member have any kind of symptoms, they would be isolated immediately and be asked to be picked up from school. Procedures for implementation of remote learning with limited notice. This is something that we're looking to put into place because if there has to be another school closure for any reason, whether it's something in the district or something outside the district that's causing us to do that, we want to make sure that we're ready to go. The district will also provide return to school guidance to staff, parents, and students. There will be a lot of information coming out to parents through the month of August to prepare for September. And we will be developing a website on our webpage from each school's webpage that all of this information will be available, including this PowerPoint will be available tomorrow. Technology that was brought up a little while ago also, we need to make sure that all families have a working device and internet access. Students will receive direct instruction on virtual classroom norms, procedures, and etiquette, as well as good digital citizenship practices. That's something that we're working on now. Assignments can be found in centralized platforms. So for K-8, we'll be using Google Classroom, and grades 9 through 12, Schoology. And again, families will receive information on navigating these platforms to find student assignments. So for the health and wellness, we are going to be implementing a two-step screening process, and this plan came out of our health and safety subcommittee. So all students and staff will complete a daily exposure symptom survey prior to entering the building or boarding the bus. So this will be done online. Genesis is looking to create a module, so since parents are already familiar with Genesis and attendance reporting, we figured that may be the best way to go. So we are still looking into this. So every student who's coming to school and every staff member who's coming into the school that day must complete a survey, or they will not be allowed in the school. And then students and staff will be screened daily as they enter the building with temperature checks and as they're coming in to every building. We will continue with our mental health training for staff and social emotional support for students. And then the counselors and child study team will also check in with students who've been identified in the past as having anxiety and or related mental health conditions for heightened anxiety as we return to school, because we know that this is a very anxious time for everybody. Transportation. We are looking to have our buses run at a reduced capacity to ensure social distancing as much as possible. Students must complete online screening prior to entering the bus. So again, that's the online screening piece, the questionnaire. Students will be required to wear face coverings on the bus, and the drivers will also be wearing face coverings. The buses will be disinfected between runs, and parents will be asked to transport their children to reduce bus capacity. So be on the lookout. It will not be distributed this week. It'll be distributed next week. A parent transportation waiver. So if you're choosing as a parent to opt out of transportation, then you will be able to do that via the survey, and that will help us as we're planning for our bus routes for the fall. That information will be coming out next week. So if I was giving this presentation last week, the guidance that we had received from the state of New Jersey was that we could not offer a full remote option for students. As of July 20th, we are now allowed to offer a remote learning opportunity. So if there are families who choose that for their children to not return to in-person learning, we will be offering a fully remote option. I do not know the specifics of that yet. That is something that is still in the works. Students who are in person will be in attendance on a 4-hour session schedule. No lunch, student lunch will be served, but students on free and reduced lunch will continue to receive lunch deliveries. Instructional information for return to school will be sent out during the month of August. Again, we'll continue to update as we get more information. With regard to instruction, students will be assessed and provided additional support as needed. We're looking at lots of different opportunities to utilize our staff to help provide that support to students. Staff will receive additional training in blended learning to make the transition between in-person and remote as seamless as possible, and to assure that they are prepared in the event that we must return to a full remote learning option. We are also working over the summer with a couple of committees of teachers who will be working on creating some lessons to kind of help with that model and more special development. Students and parents provided resources to ensure that they can effectively navigate and access the information on classroom methodology. And in conjunction with doing the hybrid instruction, we are looking at a remote learning plan if we have to go full remote. So it's basically kind of a snapshot of a student's day of arrival. So step one is going to be the screening Genesis. So these are some of the questions that will be asked during that screening that will have to be done each day. and the students, if they ride on the bus or if they get driven to school, however they get to school, socially distanced different from the bus. Once they're at school, you're going to stagger drop-off times so that the buses are not arriving at the same time as parents, so that we can make sure that we're distancing students as they're coming into the building so that we can screen them effectively. And then we'll be taking temperatures of everyone who's entering the building, and anyone who has an elevated temperature will be immediately placed in the isolation room, or anyone that answers anything specific to these questions will also be placed in an isolation room, and anyone who develops any symptoms throughout the day will be placed in an isolation room, and there will be a procedure on what we need to do. So for the K to 8, so K to 8, there are several options. The first option is the 100% in-person option. Because of our class sizes and our facilities, that really isn't an option for us at this time. So we're not able to do that. So we need to look at a blended learning model. We're calling it the eFalcon option. So our eFalcon now is kind of our remote learning revised. You know, we've learned from what happened in the spring. We want to make sure that we're upping our game and providing everything that we can for our students in the remote environment. So basically what will happen is we'll be dividing students into cohorts based on alphabet so that families will be together on which days they're in school and which days they're not in school. And again, this is K to 8. So half of the cohort, so for example, you see on the screen, the purple cohort will go Monday and Tuesday and alternating Wednesdays in person, and then Thursdays and Fridays remote. The gold cohort would go the opposite. That gives us that day in between where we can really thoroughly clean before we mix cohorts of students in any classroom environment. We are looking at special education, our ELL population, our at-risk students. We are looking at some other types of schedules that we could look at to support students in those groups. And then, so students would be in person in the morning, and then in the afternoon, there would be a virtual piece from home. So the whole class would be together in the afternoon for the virtual piece. But if they're home working remotely, they'll have work to do in the morning, but then they'll still be meeting with the teacher every day in the afternoon. The other option is the 100% remote option, which is students who are, if there's a medical necessity why they cannot be in school, or parents do not want them in school and they've opted out, they'll be able to do that. So that will be done fully remote, and we will be utilizing staff in a fully remote option for that. The high school is much more difficult. We have looked at many schedules to try and figure out what the best way would be for our students to be able to participate in the schedule of classes that they are used to. And so for the most part, the majority of our high school students are going to be fully remote. We will bring students in person for our special populations, like our L students, our English language learner students, special education students in the IEP process, or identified students in our enrichment students. And then they will have in-person support provided for them in school during that half-day session. And then as the health crisis conditions change, we can look to add more students and bring more students back in school. But this is really, because of our complexity of our schedule for our high school students, there was no way to bring all of our students back into the school. So there's lots of variables with this plan. As I mentioned in the beginning, this is definitely a plan and work in process. Things could change. Lots of things could change. The health-wise could change. We could be going to full remote. So please take that into consideration as you're looking at it. The number of families who select remote learning could change the model. The number of families who waive transportation will impact busing. The number of staff who are unable to return to school for whatever reason may impact schedules. It's dependent on decisions on the state level, and any additional schedules, will be developed as we respond to possible changes. As I mentioned before, we are looking at students with special needs and making sure that we're providing the support that they need. So we are looking at that. A survey will be going out to families of special education students next week to see what else we can do to support them. looking at other options for some PPE, personal protective equipment in some of the special education classrooms. And we're also researching options for speech, occupational, and physical therapy to be provided in either remote and/or live instruction. So we're continuing to research. Again, the eFalcon program is now our 100% remote instruction. We are looking at enhanced remote learning experience and virtual instruction. It's going to set an online schedule that mirrors the school schedule as much as possible to facilitate a smooth transition to in-person learning, when hopefully we'll be able to do that. Students will have to participate in their class sessions and attendance will be taken. And again, the goal is to replicate the classroom experience as much as possible. And we will be using a full remote option if we have to, if there's any event where we have to close a school. Some other things that we are looking at, no field trips before January 1st, no in-person large group events, no in-person whole school or grade level assemblies. We're researching options for back to school evenings and parent-teacher conferences. Guidance will be coming from the New Jersey DOE on security drills, so that's something that we have to consider also. No visitors will be permitted in our buildings during the school day unless prior arrangements have been made, and we are limiting our outside building use to ensure safety for all of our students and staff. Athletics information came out from Mr. Byer today. So we are recommending, this plan recommends a 1-month season from August 1st to August 28th, which allows for the phase 1 start of fall athletics. And then from August 29th to September 14th, it's a mandatory virtual session for all schools and all student athletes before the season actually starts. Falcon Care and ECE. So with the schedule that we are possibly looking at, the Falcon Care will still be providing before and after school childcare in our elementary schools. We are also looking to explore the possibility of in-district childcare for students and staff members. And we'll be looking, we're still looking at that. That's still in the beginning phases to see if this is something that we can accommodate for our families and our staff. So what happens if, I think someone asked this question earlier, if an infected person has been in a school building, we will work with our local health officials and follow the CDC guidelines. So if we find out that a student or a staff member has been infected, we must dismiss all of our students and their staff for 2 to 5 days in the building. This gives us, you have to wait 24 hours, and then there has to be a deep cleaning after 24 hours. This initial short-term closure allows time for local health officials to gain a better understanding of the situation impacting the school. The local health department will be the ones that do the contact tracing and notify the contact tracers. We will help them with schedules and things like that, but they will be doing most of that. So the staff, students, and families are encouraged to continue to follow all guidance from the Department of Health and local health authorities, and contacts may be quarantined and placed on remote learning for 14 days. So we have that option in there that we'll be able to put people on remote learning if we need to. So some important upcoming dates. There will be a parent learning form, remote learning form, that will be coming out next week, asking if there's any parent that wants to commit to remote learning through January. A parent transportation waiver, again, will be coming out next week. It will be the same form through Genesis. We are looking at finalized schedules to go out in early August. And again, the first day of school is September 3rd. So again, this is a work in progress. And it definitely could have things changing as we move forward in this.